You know when you call your physician now and you get annoyed because they tell you that you've got to wait? Right, for months to see them? Imagine when that is, you need to wait 2 years to see them. This country is already headed very quickly for a horrendous physician shortage. Average rate of Black men in medicine is now less than it was in the 1970s. Because we're experiencing it in some specialties right now. There are only 600 Black orthopedic surgeons in this country. 600 of them. Quite frankly, what we are seeing is that Black mamas and Black babies live longer when they have Black doctors. We have to stop acting as if we don't recognize what the real structural barriers are, and that we run to the source of them and that we begin to remove them. And what is unique is that right now, while we are at a point in time when DEI and anything that even looks like it is being attacked, understand that that means that the schools where these students are attending can no longer provide minority scholarships. Think about that.
Welcome to Cooking Up Conversations. This is a series of events that we're holding to talk about some of the key complex issues that we're confronting and, importantly, outline solutions.
The National Medical Fellowships. What is NMF?
NMF is the sole private nonprofit organization in this country that has been advancing health equity at the intersection of the health-wealth gap for the last 80 years.
80 years.
80 years. We have given the country and the world well over 35,000 Black and brown physicians by helping them to pay their way through medical school.
Mic drop. Okay.
Why is it important to have a Black doctor as opposed to a white doctor, as opposed to a brown doctor? Why is that important when you go into a hospital or you go to your general practitioner?
When they are dealing with a physician that looks like them, has a shared lived experience, perhaps comes from a community that they recognize, they have a higher tendency of being medically compliant, and it helps get people in the position of preventing illness. And our students are more likely to return to the communities that have been disenfranchised and pushed to the margins. We are making certain that they are becoming the physicians that their families actually always needed, but did not have. And we're giving you those who are making certain that there's a path for everyone else to follow. Everyone is welcome to this table. We cannot do this alone. We cannot do this without having proper partners who are willing to help us to reach every student who has a dream of entering these fields, and ensuring that there are more physicians of color leading so that we are bettering medical efficacy on the Black body.
We are a global enterprise that focuses on economic opportunity, economic justice, and economic freedom. We are a sister company to Essence. And what we're doing here in Martha's Vineyard is really having conversations about issues that directly affect the marginalized communities.